got to learn how to love and be with solidarity with all of our brothers and sisters who are wrestling with AIDS. I don't care what color, what country. I don't care if you're straight. I don't care if you're gay, lesbian. I don't care if you're bisexual, transgender. We in this together.
Study which shows that the lifestyle of some male homosexuals has triggered an epidemic.
The disease has already claimed more victims than Legionnaire's disease and toxic shock syndrome combined. At first, it seemed to strike only one segment of the population.
It's called AIDS, AIDS. New cases of HIV in LA County are on the rise.
Tens of millions are expected to die of AIDS.
Close to 40 million people in the world live with HIV.
Back then, a diagnosis was also a death sentence.
Negative attitudes about HIV are literally killing people.
There is no cure. No cure, no cure, no cure.
What do people actually need? And literally, people were dying in the hallways of the county hospital. And so he said, the least we can do is give people a dignified death. We formed this blue ribbon panel, this commission on hospice care, and we held an all-day-long thing, and we had people come and testify what the needs were.
How many of you have been to 5P21, the AIDS unit at USC? You see patients who are weighing 90 pounds sitting on a wooden bench for 3 to 4 hours. This is not humane to me.
But then we started campaigning about the neglect that LA County was visiting upon the community. And so we wound up having a candlelight march to the home of the then chair of the Board of Supervisors, Mike Antonovich. This is the first time in the history of Los Angeles that people went in asking for $400,000 and walked out with $2 million. Once we had established the hospices and we had given people a place to live out their last days, began to see that treatments for opportunistic infections were improving, and so the life expectancy was expanding. So we realized that what people really needed was medical treatment in an outpatient setting. So we began opening up clinics. So we said we can't operate clinics for the living with a name like the AIDS Hospice Foundation, so we changed it to the AIDS Healthcare Foundation.
I remember when we opened Lynn House, our very first patient was a young man. He was in his mid-20s. He came to us almost comatose. We did not expect him to live through the night. But the nurses were there, and they wouldn't leave his side. He had never had an antiretroviral. He collapsed at home and was hospitalized, and they just decided to put him on hospice. And so they sent him to Lynn House. The nurses decided they weren't going to give up. So we crushed his pills. We helped him drink. We exercised him in bed. We gave him everything we had. And that young man got up and walked out of Lynn House. And he's still alive today in the Midwest somewhere. Nurses do a lot of things, and our nurses at AHF do those things, like I just described, each and every day.
Well, when we introduced this social enterprise model, at the very beginning, it was with the thrift stores. And that was a kind of a tried and true thing. You have Goodwill, you have Salvation Army and other groups. We've put a little different twist on it. People loved the double meaning of the name, and we had very cute graphics and such. And then in later years, we incorporated testing into it, and then we incorporated the pharmacies into it as well. Our second venture in social enterprise, the big one was the introduction of managed care, where we became a health plan. And through that, we were able to create an umbrella for our clients that covered all the services, but also there was income from that was disposable that we could use. And then finally, what was sort of the big breakthrough for us was the creation of AHF Pharmacy, where we supply medications primarily to our own clients, but to people outside as well, and that's really been a boon for us as far as our budget is concerned, and having the ability to do many things, whether it's the global treatment program, which is the vast majority of AHF's patients, more than 700,000, or whether it's to do other innovative programs like the kind of testing we do, or providing STD services, and the advocacy as well.
There are so many organizations out there that are doing good work, whether we're talking about the United States or in Africa or in Latin America, but they're entirely reliant upon the grant funding that they receive. And they can't speak up against the people who are funding them because obviously they need that funding to stay in business.
Well, the reason that we went into the social enterprise model is because we felt very hamstrung by government grants. We felt really had no independence in that model. And so we felt like we needed something that would allow us both to be independent and also self-sustaining. The grant limits the amount of money you have for administration, and there's no money available to expand your program. It's a constant battle to put on the next event or to have the next fund drive, and it kind of diverts your attention away from your central mission.
We're not raising money to support shareholders or to make people rich. We're saving lives. That we are good caretakers of that money, and we're good caretakers of the people who entrust their lives to us.
3 months ago, my CD4 was 165. I can get up in the morning and see to my kids. I can prepare their breakfast. I can supervise homework. I can work. And most of all, I can be around at least that my children see adulthood before I leave them.
Shortly after the success of the Utem Balabantu clinic near Durban, AHF went on to open another clinic in Uganda.
By the time AHF came to Uganda, the situation was already very dire.
Our staff figured out that we had prevented more than 7,000 orphans. That was quite a moving day for me. I just remember thinking, the enormity of the work we were doing and how important it was. One night it was late, and I was driving with one of our staff people in Uganda, and as we pulled up to the airport, the security approached the car, and they motioned for me to roll down my window. And so I did, and the guy leaned into the car and said, "Are you with AIDS Healthcare Foundation? Are you with Uganda Cares?" And I said, "Yes." And he said, "Thank you for saving my brother."
You have my promise today that AIDS Healthcare Foundation will be here to help for as long as we are needed.
So where we are now, as the largest AIDS organization in the world, advocacy is still very important, but what we've decided to do is ratchet up to much higher levels. Like in countries around the world, we want to meet with the members of parliament. We want to meet with the prime minister. We want to meet with the health secretary, because those are the ways to actually change policy. There's still so much to do for all of us at AHF and around the world that work in this field. We're going to be in 50 countries before you know it, and we really have to keep the advocacy up for test and treat.
If we ran air traffic control the way we run global public health, planes would be colliding in the sky every single day. It's chaotic.
It's important for AHF to continue fighting for what's right. There is a goal and a plan to stop AIDS by 2030, but with a lot of shakeup and a lot of fighting to restore a sense of urgency and maintain it. So we feel we have a very strong role. AIDS is not over, and that we're still in a crisis.
To the people who work for AHF, I'm incredibly proud of you. To take as much pride and that they understand what an important contributor they are to the big success that we've had.